A new study suggests that losing weight through bariatric surgery can decrease your risk of obesity-associated cancers and cancer-related mortality. But here's the question. Is it just weight loss surgery that gives you these benefits? That's not known, but another study shows similar degree of weight loss with a new medication. So what do you need to know about this medication to see if it's right for you, and what else are other options for this degree of weight loss? I'm Dr. Brett Scher, the medical director at DietDoctor.com, and I want to dig into these studies with you because I think it's really important to kind of get a sense of what are the benefits of significant weight loss, right? Because we talk about all the risks of obesity, especially with visceral adipose tissue, the abdominal obesity, high body fat mass with low lean mass, and all the associated conditions that can go along with these. And a number of them are obesity-related cancers. There are a number of different cancers that are designated as obesity-related cancers, and these are esophageal, renal cell, postmenopausal breast cancer, stomach, colon, rectal, liver, gallbladder, pancreas, ovary, thyroid. There's a whole slew of cancers that show a slightly higher association, or slightly or not so slightly higher association with people who are obese. And for that reason, they are labeled obesity-associated cancers. Well, there was a new publication in JAMA titled Associations of Bariatric Surgery with Cancer Risk and Mortality in Adults with Obesity. And part of the premise of this was, sure, these cancers might be associated with obesity, but does losing weight significantly reduce your risk of getting these cancers? And the answer, according to this study, was yes. Now, it's pretty impossible to do a large randomized controlled trial for many years to surgery or not surgery to see the incidence of cancer, because it takes, a decade basically for that kind of follow-up to get the power you need to detect is there a difference in cancer. So what they did was they took 5,000 people who underwent bariatric surgery and matched them to controls. They did their best to match them to controls, or 25,000 who did not undergo surgery and just underwent sort of standard of care lifestyle interventions. The primary endpoints were incidence of any obesity-related cancer and any cancer-related mortality. And like I said, they were both significantly reduced with the group that underwent bariatric surgery. So everybody had to have a body mass index of greater than 35. The mean follow-up was 6 years, although they reported 10-year follow-up as well. Those in the surgery group lost 27.5 kilos, which is pretty impressive, especially if you can maintain that weight loss for 6 years or more. And the control group was 2.7 kilos, so huge difference. And the obesity-related cancer incidence was 2.9% in the bariatric surgery group and 4.9% in the control group, for a hazard ratio of 0.68 reduction and an absolute risk reduction of 2%. Whereas the cancer mortality was 0.8% versus 1.4% for a hazard ratio of 0.5. So significant reductions in the group that underwent bariatric surgery. Certainly didn't eliminate the risk, and you wouldn't expect that it necessarily would eliminate the risk, but it was significantly less. But now here's the interesting point. The title of it is Association of Bariatric Surgery with Cancer Risk. Why isn't it just the association of weight loss, right? Because I don't believe personally that it was anything specific about weight loss surgery that reduced the cancer risk and the risk of dying from cancers any more so than it was just the weight loss. But you could argue, where are you going to get that degree of weight loss? 27 kilos over 6 years is a huge amount of weight loss to be able to maintain, and very impressive. Most lifestyle trials can't do that. But one thing that was clear in this study was that it was sort of a linear association. The more weight you lost, the more you decreased your risk of developing obesity-related cancer, and the less weight you lost, the less you decreased your risk. So that was pretty linear. But why am I tying this in with this other study? Other study published in the New England Journal of Medicine is titled Tirzepatide Once Weekly for the Treatment of Obesity. Now, this is a medication, not surgery, and it was a 72-week trial, so it lasted less than a year and a half, so obviously not as long. But first, what is tirzepatide? We've talked about the semaglutide, liraglutide, the GLP-1 agonist, and it's a specific type of medication initially developed for type 2 diabetes, but then found to be very successful for weight loss. Well, tirzepatide is not just a GLP-1 agonist, but also a GIP agonist, so it sort of has two mechanisms of action. And this trial was a stage 3 clinical trial where they tested out 3 different doses, the 5, 10, and the 15 milligram dose. The 10 milligrams seemed to be the best sort of quote unquote bang for your buck in terms of benefits. You didn't get a whole lot more by going to the 15. So I'll focus on the results of the 10 milligram compared to placebo. Now, it's a once a week injection, and everybody was given dietary advice or lifestyle advice for eating balanced meals with a 500 calorie deficit and 150 minutes of weekly exercise. So, take that for what you will for how effective that usually is. And the primary endpoint was total amount of weight loss, or also the percent who lost more than 5% of their body weight. Now, interesting, there was a 7% discontinuation rate in the tirzepatide group. There was, an 80% side effect risk. Over 80% of the people experienced side effects, but only 7% discontinued. So they led them to conclude the majority of the side effects were sort of mild and not worthy of discontinuation. But to cut to the chase, the 10 milligram group lost 22 kilograms. So similar, a little less, but similar to what I just mentioned in the previous study for bariatric surgery. Obviously shorter follow-up time, but still pretty impressive, 22 kilograms, whereas the placebo group lost 2.4 kilograms. So really significant difference there. And here's the other thing, 90% of the people in the tirzepatide group lost more than 5% of their weight. And that's important because usually 5%, based on some historical data, is sort of the cutoff point for clinically significant weight loss to help with metabolic health. In the placebo group, 35% did. So that's actually still pretty good, greater than I would have thought. But here's another thing. 95% of the people with prediabetes in the 10 milligram group normalized their prediabetes. So that's pretty impressive too. So, but I did mention that there was 80% side effects, the most common being about 31%, 33% with nausea, 21% with diarrhea, 17% with constipation, about 10% with heartburn, 10% with vomiting, 11% with decreased appetite. And, those were all pretty much more than in the placebo group, more significant in the placebo group. So there's no free lunch, so to speak, right? This drug is very effective for weight loss, comes with some side effects. How does that affect your quality of life? How would that affect you personally? But to get back to the point of that bariatric surgery, the weight loss surgery trial that showed decreased risk of cancer incidence and cancer mortality, would the same hold true for a medication like this that had similar degrees of weight loss? I think the answer is probably yes. Now, but what about other ways to do this with lifestyle interventions that don't have bad side effects, that don't require a major surgery? So the timing is also good that there was a recent poster presentation at the American Diabetes Association. So not published in a journal yet, but it's the 5-year data from Virta Health. 5-year weight and glycemic outcomes following a very low carbohydrate intervention, including nutritional ketosis in patients with type 2 diabetes. And so this is a non-randomized trial that used a ketogenic diet and their coaching and their app support out to 5 years. And they found an average weight loss of 8.8 kilograms. So not to the degree of the medication or the of bariatric surgery, but still 8.8 kilograms, which is certainly better than the placebo groups did in either of those, right? Because remember, in one they lost 2.4 kilos, and in the other they lost 2.7 kilos. So here they lost 8.8 kilos. So clearly better with the Virta Health program using the ketogenic diet and their online support. But now the big question is, what degree of weight loss do you need to see that reduction in obesity-related cancers? And that's unknown, but I think it's clear that weight loss does benefit. We have some means for very significant weight loss, whether that's surgery, whether that's medication. But what are you comparing it against? And the control groups generally do pretty poorly with general dietary lifestyle advice. Whereas one example is this Virta Health trial where they did much better from a lifestyle standpoint with 8.8 kilos of weight loss. And we can always hypothesize, right? What would we do if we also had a higher satiety eating group that also had some, more structured exercise intervention and et cetera, et cetera, et cetera, right? I guess the point is there are more ways to approach this, but surgery works, medications work, and lifestyle works better than those controls, and they likely will be able to reduce risk of obesity-related cancers and cancer mortality. So That's important. So this was sort of a whirlwind trying to, weave in these 3 trials that all came out recently to show how they're related, but also how they're different and how it might apply to you. So if you want to learn more about all of this, about ketogenic diets, about higher satiety eating, about healthy weight loss, check us out at dietdoctor.com. We have a whole slew of educational guides and programs to help you get started on your health journey. Thanks a lot, everybody. We'll see you here next time on Diet Doctor News on YouTube.